Hello everyone, a very good afternoon and thank you for joining us to this webinar, the Introduction to Teaching and Assessment for Nursing and Allied Health Educators, which is the latest online programme from Epigeum. So just a couple of housekeeping things before we get started. We should be taking around 30 to 45 minutes of your time up this afternoon, depending on how much time we allocate for questions. And we will be making a recording available as well, so you can watch at a later date or share with colleagues if need be, and that will be available early next week. Finally, you are all on mute at the moment, but if you have any questions, we're happy to take them as we go along. So on the right-hand side of your screen, you should have the GoToMeeting panel. Okay, so firstly, just a couple of introductions. I'm on the right-hand side, Carla Whitcomb. I work in the marketing department for Epigeum, and one of the kind of large parts of my role is to help universities in promoting the courses that they have within their institutions, so letting their staff and students know that our materials are available for them to use. And I'll let Dr. Nigel Harrison introduce himself. He's there on the left-hand side.
Hi, so I'm Nigel Harrison. I'm the Executive Dean for the College of Health and Wellbeing at the University of Central Lancashire, and I've been involved as a UK advisor on the Epigeum teaching and assessment for medical nursing and allied health educators. Thanks,
Nigel. So quickly, just a little bit of a look at the agenda for this afternoon. So firstly, have a little bit of a look at Epigeum. So we're the organisation that put together the programmes, and the way we do it is through a collaborative model, which is quite unique. So I'll talk you a little bit through that model. And then Nigel will give you an overview of the Teaching and Assessment for Nursing and Allied Health Educators programme, so the vision that he had as lead advisor. And then I'll give you a demonstration of the programme so you can see the elements of that and how it might work for you. We'll look at the benefits of using the programme, and then we've got time for a Q&A at the end. So firstly, just a little bit about Epigeum. So we were founded in 2005 as a spin-out from Imperial College London, and one of our co-founders was doing a PhD alongside working full-time, and just found that the level of support that he was getting as a researcher, it was either kind of 3 months until a face-to-face session, or it had already expired, and the online materials that he had access to were just quite inadequate. So he wanted to create some supportive materials for researchers, particularly kind of PhD students and postdocs like himself, that gave just-in-time support for all of those issues. So that's really where we started, in that research space. And in the 10 years since, we've expanded that. So we've got a lot of studying programs as well, so courses for students, and a lot of teaching programs as well. So we have programs for staff, of which this is one of them. And in May this year, we were acquired by Oxford University Press. They are a division of Oxford University. We've stayed very much within the sector and providing materials from the sector. We're continuing our goal of providing high quality online materials. So at the moment, we've got 18 programs, and we've actually got 7 in development as well. So we work with a lot of universities. So to date, we've worked with 260 universities worldwide, and that's across 29 different countries. So although we were founded in the UK and we very much have a big presence in the UK, we are now working with many different universities globally. And so I just wanted to touch on the collaborative model. So the way that Epigeum put these courses together is that we kind of do some market research in-house. We get a feeling of what the sector needs, where there's a gap in training resources, basically. And then we go out and we find some universities who want to partner with us to create those materials. And we then appoint a lead advisor. So in this case, Nigel, somebody who's got the expertise in the area to help lead and shape the vision for the programme. And so these universities, there's up to about 20 typically that come on board with us. They all fund the programme, and they all have significant input into the programme, and then at the end they get it to use in perpetuity. So there's various different ways in which we ensure that it's of the sector. So the universities get a chance to comment on the course outlines right at the beginning. They then get invited to a 2-day workshop. So they come along, they meet all of the authors, all of the people who are writing the material, and they get to talk about how the curriculum could work for them, things that they might want to change, add. whatever it is, they get a chance to talk to the author about it over the course of those 2 days. And then after 4 or 5 months of the authors going away and writing up that curriculum, they then get a chance to look at that in something we call the alpha review. So at this stage, it's just a Word document. We don't have all of the interactive features of an online program yet, but it's a really good opportunity for them to look at the content, check that it matches their expectations, they get to comment on it, and we get hundreds of comments at this stage, of which we try and incorporate as many as possible. And then after that, after another 6 months of kind of development work, the courses are ready for them to use, and then we can go out to other universities and license that for them to use as well. So hopefully that's given you a little bit of background to Epigeum, how we put our programs together. I'd be happy to take any questions on that process as well. But for now, I'd like to hand over to Dr. Nigel Harrison to talk to you about the foundations of the program and his vision for it.
Thanks very much, Carla. So my role at the university is that of Executive Dean for the College of Health and Wellbeing. And what I'd like to just talk through now is my own background and experience and why I got involved in this, and really to highlight the need for the compliance with the relevant professional bodies, the Nursing Midwifery Council, the Healthcare Professions Council, and how this program will help HEIs to do that, and really what the need for the resource and the program is, and the vision for how it could be used in a variety of different ways with students in the future. Okay, so my own background is that I have 4 schools within my college: a School of Nursing, a School of Community Health and Midwifery, a School of Health Sciences, and a School of Sport and Wellbeing, with approximately about 6,500 students within the college, and just over 300 academic staff. And a large number of the courses that sit within those schools, the students undertake clinical placements, and that involves practice assessments, and they all have a need for a mentor and support, and that those mentors have to be prepared for their role. So in terms of my own personal background, I am an adult nurse and a mental health nurse, and I worked for a number of years as a cognitive behaviour therapist. And in the past, I have actually been the course leader for a mentorship preparation program, which is one of the reasons why I was interested in getting involved. I have, for about 6-7 years, been an NMC reviewer, and been involved in going to different universities in England, Scotland, Ireland, and Wales, and approving and monitoring a variety of NMC programs, including the mentorship program. And I have also been involved with the HEA initially as a fellow and more recently as a principal fellow. And I have particular interest in education, having done a doctorate in education and led service user carer involvement in writing courses, delivering courses, assessing students, and being involved in engaging in research. So I have a particular passion for involving service users and carers in all of that we do. And in the past, I have been involved in writing other education and training packages, in particular the IAP program, the resource that supports the Improving Access to Psychological Therapies program, which again was an interactive online tool that could be used flexibly, either in using it with blended learning or taught programs. So ultimately, I'm very, very committed to enhancing student experience because of my background and experience. I suppose the other thing to say is that we have between 300 and 400 students in any one year that undertake the mentorship preparation program at the university. So the other reason for getting involved in this was that I was particularly interested in any resource that could actually help us deliver that program, because it is there is a real need, and there is a need for consistency of the people that are facilitating that program, and I saw that this resource could actually help with that and help us deliver a program that is in great need and great demand. So if we just think through the need for the program in terms of what, as a university, what we all have to think about. One thing that as a dean, I'm very mindful of the need to be compliant with the professional body education and training standards. And the mentorship program that we have here and that many universities will have are guided by those national standards and needing to demonstrate that the age domains are covered. So, you know, there is the content around preparing mentors to work effectively in terms of their relationships and to facilitate learning, to be involved in assessment, to be accountable for their assessment decisions, to be able to evaluate the learning in practice, to create suitable learning environments, and to think about the context in which practice occurs, where learners are situated, and to make sure that what they do is evidence-based and that they have a coordinating and leadership role within that. And the professional bodies are very prescriptive in terms of that any mentorship preparation program has all of those 8 domains within them. So in getting involved in this, one of the things that I was keen to ensure was that the program was compliant with that and actually had elements of all of those domains within the resource. And the other facets of the NMC standards are that the any mentorship preparation program, when it's delivered, has to be minimally at academic level 5, that there are 10 days, 5 of which are protected learning time, that there is learning that is undertaken in academic and practice settings, has an element of work-based learning, is completed within a particular time frame, and there is the opportunity to allow APEL. And similar to the NMC, the Healthcare Professionals Council also have their own education and training standards that most people will be familiar with, and they're a little bit more flexible and less prescriptive, but even so, they provide some very clear guidance. They say that all students that are learning, that people have to have teaching qualifications, and that there must be an adequate number of qualified and experienced staff in the practice setting supporting students, and that practice placement educators need to be qualified who are supervising students. And they also highlight in their standards that practice placement educators must undertake appropriate training and refresher training, and that they need to be prepared to deliver formative and summative assessments, although they don't actually specify the length and content of the training that they ask educators to have. The HCPC also, like many professional bodies, have really emphasised now the importance of service users being involved in student learning and in supporting students during their placements, particularly students who have particular needs and may have adjustments because of learning difficulties, and that people need to be prepared for supporting those sorts of students, and that staff and students carrying out assessments need to think about risk within practice settings and prepared for that and to do that, and that education providers must maintain a system of approving and monitoring placements. So having that knowledge and having had to think about that in the past in terms of mentorship preparation programs and incorporate that in programs that we've had approved here at the university, any resource that was being developed, I, as the lead advisor, was mindful to try and ensure that those professional body requirements were incorporated into the resource and into the program. So in summary, really, in terms of the need for the resource and the program, there is definitely a need for effective mentorship preparation programs. All HEIs are preparing lots of mentors every year, and that is ongoing. That need is there and is not going to go away. And that there's a large number of students and staff turnover, which does necessitate the need for continuing to prepare lots of mentors, and that mentors play a key role now in retaining students. We all have targets for retention of students, both by our own respective universities, but by commissioners as well. And if you prepare mentors well, they play a really effective role in helping to keep students, given that they spend half of their placement, half of their course on placement. And it's really important that mentors are competent to act as effective role models for students and understand the importance that they play in this, and that there's they help for consistent standards between mentor preparation, in that if we get a good program that prepares mentors and a good resource to support the teaching of mentorship, regardless of who's facilitating a mentor program, whether that be in a university or the different sites that a university might have, and depending on how many mentor programs there are within a given year, I see that a resource like this can ensure consistency between those different facilitators, irrespective of where it's facilitated. And the other thing that commissioners and placement providers are continually looking for is value for money. So a resource like this I see as enhancing the quality of the provision, the portfolio, and the delivery of teaching and learning around mentorship preparation. So in terms of what's the vision then for the program? So what are the benefits? What can it be used for? Why is it important? So people that work in higher education will be very mindful of the fact that we've had the Education Outcomes Framework in 2013, and it very much emphasises the need for delivering excellent education, preparing competent, capable staff, and a flexible workforce that is receptive to research and innovation, and it's consistent with the NHS values and behaviours, and respectful of widening participation. And alongside that, we've had all the national frameworks which have particular implications for education, practice and service development. So as well as the NHS Outcomes Framework, we've got the Public Health Outcomes Framework and the Adult Outcomes Framework that all emphasise the importance of education and training and the quality of education and training. So in terms of quality education, there have been other key policy documents, in particular Patients First and Foremost in 2013, following the initial government response to the report of the Mid-Staffordshire NHS Foundation public inquiry, talks about ensuring that staff are trained and motivated and up to date and fit to practice. And the Cavendish Review ensures that healthcare assistants are properly trained and inducted as well. So in terms of the professional body standards and the numbers of mentors needed and a lot of policy documents, it all emphasises the importance of really preparing mentors for their role as effectively as we can. And so I see the use of the teaching and assessment for nursing and allied healthcare educators having lots of benefits in that it provides courses for preparing mentors and nurses and midwives with a resource to use in a variety of different ways. And delivering workshops, it can also be used for delivering workshops in the preparation of clinical educators of allied health students. Resource could also be used in a variety of different ways, either delivering taught or blended learning or e-learning programs. So there's that flexibility in terms of people who are using it to use it in a variety of different ways. And the program can also be used for delivering mentor updates, either in university or practice settings. So you could extract particular aspects of the program and some of the exercises for afternoons or day events, day workshops for updating mentors, particularly looking at aspects of assessment or evaluation or aspects of teaching or learning. The resource can also be used to deliver aspects of teaching and assessment and learning with a range of different types of pre-registration students, nursing, midwifery, or allied health professionals. A lot of pre-registration programs now towards the end of the program, sometimes linked with leadership modules, will start to look at the role of students moving into qualified practitioner roles and how they will pick up within their qualified role teaching and assessment and learning. So as well as actually being used in preparation of mentors, the resource could be used for students coming towards the end of their program who need to start thinking now about their role in teaching and assessing. And the other thing that is particularly important is preparing patients and carers that are involved in preparing curriculum and helping write curriculum and teaching students and in assessing students, how we brief and prepare them for that role. And I see that this resource could be really valuable in helping prepare service users for their role in higher education. So hopefully that helped to illustrate why I got involved and how I see this resource being a really valuable asset to anybody delivering a range of aspects of mentorship preparation, but not just mentorship preparation. It could be used in a range of different workshops for different target audiences. And of course, I'm happy to take any questions on that.
Okay. I haven't seen any questions come through just yet, so perhaps if I do the demonstration and then we take them all at the end where we've got the Q&A, and just to give you a little bit of a chance to reflect on Nigel's presentation and think of any questions, and also if you have any as a result of kind of looking at what the program looks like. So I'll go into the Epigeum portal now so you can have a look at this particular program. This is what it looks like in the Epigeum portal, so we can host the program for you. It's worth noting that most of our universities who are using our courses actually do so on their own virtual learning environment or learning management system, simply because when you put it in your own system, not only are you familiar with those processes, but it also enables you to customize the materials a little bit more and keep up more of a track about usage numbers and things like that. So we'll have a little bit more of a look at customization and how you might think about making the program even more tailored to your needs as we go through, but that's just something to note. So here you can see the two courses that make up the Teaching and Assessment for Nursing and Allied Health Educators program. We've got one on clinical teaching and learning and one on clinical assessment, feedback and evaluation. So I'll just take you into the course properly now. The first thing I wanted to show you was this welcome screen, which is something that we have for all of the different courses within our programs. And this gives us a chance to introduce the authors. So here you can see Nigel Harrison there, and also Dr. Russell Gerbert, who was the author for the program as well. So you get a sense of who's helped create the materials. There's a list of the learning outcomes. So what am I going to be able to do as a result of completing this course? A little bit of a look at the structure and some of the chronology behind how you're going to go about taking this course. A look at all of the supporting institutions. So here on your screen now you can see all of the universities and colleges who contributed to creating this program. So this is the development group that I was talking about earlier. And these universities will be already using the program. And then some key course highlights to look out for. Okay, so I'll take you on to the first, the kind of proper screen content here. And this is a topic on interprofessional support for learning. I just wanted to point out a couple of things that are again relevant for all of the screens that we have. The first one being at the top right here, there's an estimated screen duration time. So here you can see it's 6 minutes. And these obviously vary from screen to screen, but they're a great way of your staff being able to factor in how long it's going to take them to work through any particular course. Obviously, we're very appreciative that the kind of people who are likely to be taking this programme in particular are very time sensitive. They've got a lot of competing priorities, so it's nice for them to be able to understand how long each thing's going to take them. Again, there's a learning outcome at the top of every screen, so you have an idea of what you're going to be able to do. So on this particular screen, you can see that you will have considered the contribution and resources of other professionals in student learning and their role in supporting your students. So if I move down into the main screen content, I just wanted to show you how Epigeum kind of lay out the course content. So initially you'll have a little bit of an introduction to the topic, this part on involving everybody, and then you'll have a bit of an interactive activity to look at that particular topic, a little bit more information on that, and then we'll have a presentational activity. So this is a kind of one way in which we present the information for you. So I wanted to have a little bit more of a look at this interactive activity. So this activity is designed for you to reflect on how different healthcare professionals act as a team. So here, for example, I've set up the radiographer, paramedic, doctor, nurse. And here you can see the feedback when you click on goal. Interprofessional education involves students and practitioners from different healthcare disciplines getting together to learn with, from and about each other with the specific objective of improving collaboration in healthcare. And then as you move down the screen and you have a little bit more information, we try and present this in a way that's a little bit more memorable. So here, for example, we've got this little booklet, and you click through and you can see all of those different pieces of information about interprofessional learning, but in a way that's a little bit more engaging than just reading flat text on a screen. Okay, so if I scroll back up to the top, there are a few things on the right-hand side that I wanted to show you. So you might have noticed here this little icon of interprofessional practice. So this is one of several icons that we use in this programme to represent core themes which recur throughout the course. So we've got other icons on support, professionalism and standards as well. So you'll see these as we go through popping up, and they just help guide you in terms of the particular topic that you're interested in. And if I scroll down, these little boxes, or what we refer to as pods, help kind of provide some supplementary information to that which is contained on the screen. So the first one, which is actually a unique feature of these courses and is really useful for these programs, is this one on this Did You Know pod. And these appear throughout this nursing and allied health program, intended to prompt the participants to either note how this screen theme relates to official standards and requirements, or to research their own requirements. So here you can see this is a standards one about how the material in this screen maps onto the NMC domains 1, 2 and 6. And they're the titles: Establishing Effective Working Relationships, Facilitation of Learning and Context of Practice. Okay, so also we've got this video pod here as well. So if I click on that, you can see that you've got a video which is students and professionals discussing what they've learned from working with different professions in the process of caring for service users. So here on this, you can see that it's directly related to the screen information that you've been looking at already. And the way in which we create these videos is the development group that you saw listed previously will go to each of those and will film their staff and students to get authentic material on a range of different topics. So we go visit those, and that provides us with a real nice core of video material which we can then filter down into our programme. And so the videos are very vox pop style. They're typically around a topic, 30 seconds of kind of different professionals giving their opinions. So they're nice and engaging and help move the material along. And it's worth noting as well that all of our video and audio materials have a transcript available. So when I clicked on that button, you can see here that it's all available as text for you to read through. And we try and make sure that our courses are as accessible as possible. So if I go back to the top and click here, you can see there's a text print version available. And that, when you click on that button, it makes everything flat text. So if you're using screen readers or you can't use the interactive version for any reason, you can do that. And it's also available to print if you wish. Okay, and finally on this screen, I wanted to show you this portfolio activity pod. So Nigel touched on the fact that obviously this is available entirely standalone as an online programme for your staff to study. What we do recommend is that they do extended activities and also that you use it as part of a blended learning programme. So this portfolio activity is part of us trying to find ways to extend their learning from the online material. So this is an external activity which is optional for them to do. So here you can see this is going to take them 30 minutes, and we're asking them to think about what steps can you take to capture insights into the role and contribution of different participants for your students, and what barriers might exist to interprofessional learning and how might they be addressed. And for all of these portfolio activities, we actually provide you with a Word document to help you complete them. So here you can see on this link, you can click on and that will load your Word document. And then they're available to use, they're available then for you to print, and you might want to keep them all together as a portfolio. And as a university, it's up to you how you work with this option. Some of our other teaching programs, we find that the universities actually ask the participants to complete portfolio activities and present them at the end in order to get credits and things like that. Okay, so I'll move on to this screen. This is on students and evaluation, and this again is just a nice way of showing some of the other typical activities that we have within a programme. So we're talking here about the value of student feedback, and we've got this nice little labelled graphic here. So this has got various different ways of gaining feedback from students about their learning experience. And if you click on the pinpoint, it'll reveal some feedback on that. So here, if I look at surveys, you can see the feedback about why you might want to consider using surveys to get student experience. And so you get the idea that by using all of these different types of methods, you gain a more rounded, cohesive picture, and thus can, therefore help you improve as an educator. So that's the point of that label graphic there. And also here on the right-hand side, you can see another pod, which is useful resources. And again, so it's bearing in mind the course content on the screen, but if you are particularly interested, you can go off and look at these external resources, and we update these links as well. So there's also this little pyramid little presentational activity on how you might use feedback. And this is about the pitfalls that you might encounter. So if you click on these different parts of the pyramid, they explain. So here, discarding negative comments, your clouded thinking, and being defensive. So you get a little bit of information on each of those. And you can see it's much more memorable than just reading from the screen. Okay, so this, I wanted to show you, this is from the second course. This is about the mentor's role in assessment. And this is an example of a bespoke tabbing activity as well. So we use these throughout. So the screen has introduced the responsibilities of a mentor, and now you click on the tabs to compare your thoughts with our observations. So here, assessing, and then we give you the feedback of what the mentor should be able to do in terms of assessment. And again with supervision, for example. And then you click next and you get the second screen. And again, you get to compare your thoughts with with the feedback that you get given on the screen. This is a nice example of one of our interactive activities. This is a little seesaw activity. And so here you're matching the description of the mentoring criteria. So here, to the correct item, which is listed underneath. So here we've got professional register, and so you read each of these 4 little descriptions underneath and work out which one matches. So for example, you might think it's this top one, they should be on the same registers as those they are assessing, and so you would add that. And then if that's correct, then you move on to the next one, which is about knowledge, skills and attitude. So if you click that one there and it's incorrect, you can see that it comes up with the little red cross, and then you can carry on and see if you can get that right the next time. If I scroll down, one of the pods that's really useful for us is something we call a Your Context pod. So here when I click on it, it's in its default mode, and it's saying here, what assessment training for mentors is available at your institution? But what we encourage universities to do is to actually add in some information that's relevant for their own institution. So here, for example, we'd say to them, why not send a link off to all of the different training options that you have, so that you know when somebody's doing that screen, they're particularly interested, they'd like a little bit more support, you know that it's available for them and they can go off. And it really helps your staff feel like it's a tailored program to them, and it's a really nice way of ensuring that you're getting that relevant information to them at the right time and the right place. And this Your Context Pods is just one example of how you can contextualize and customize the materials. So you can delete screens, you can add your own screens, you can reorder screens. You can do as little or as much customization basically to our programs as you like. They're available they're in this default mode. You can just put them on your VLE and go. Or you can do some real heavy customization to make it look as much like your institutional materials as possible. It's really up to you and how much, what the needs are, whether you've got the resources available, etc. But certainly here we have a team on hand to help you with all of those customization efforts, and we work with universities. Again, it's all about kind of making it as relevant to the experiences of your staff as possible. So the last main screen I wanted to show you is this one on failing students, and it's got some nice features in it, but also it's a really important topic within this area, so we've made sure that we've covered this in some detail. And so we've had a little bit look about the context, so the challenge of failing students, and then here we've got something which is a really popular feature of our Epigeum courses, and that's these poll activities. So again, it helps kind of foster a bit of a learning community when you're learning online, to feel like your peers are doing it and to have a little bit of a look at some of their reactions to similar questions that you're being asked. So here, have you ever had to make the decision to fail a student? You then vote in this polling activity here. So if you say yes and then vote, it'll come up with the percentage based on who's taken it. So here you can see that the vast majority have had to do that. And you click next to return to the poll. Okay, so also once you've kind of had a look at this information and you've reflected on the topic, we then ask you to do a text entry activity. So it's about what are your own thoughts relating to student failure here. So here we're asking you to consider what are the behaviours of the underachieving student. So here you would type in what you think, and then you get a chance to view the feedback and some of the behaviours that we've outlined as belonging to those of an underachieving student. And the final thing on this screen is a quite nice summary, which is this audio activity, which consists of 2 accounts from mentors, which is on this subject of failing students. So you can see how they've dealt with the issue there. And then again, the same thing in terms of some video content as well on the same topic there to summarise. In terms of assessment and how and the kind of application of what you've learned on screen, we have something called a practice scenario for each of the 2 courses in this programme. So here we give you a scenario which you read, and then you work through the questions on the subsequent screens. So here, this is the scenario outlined, and then you would work through a variety of different questions based on that scenario and see what you would do. So there's no right and wrong answers here, it's just how you would respond in certain situations, and then you get an opportunity to view some of the feedback. So what we think would be an idealised way to behave in a certain scenario, but it's very much practically based, so on the kind of things that you would encounter. So we're trying to give an opportunity to reflect and consolidate on your learning here and think about how you might use it in a practical setting. And finally, just a couple of things to note. Each of the courses finish up with a resource bank, which you can see here, which is all of the resources that we've used. And again, as an institution, so we've got general resources here. You might want to add in above that some of your institutional resources or other bits of information that you find useful. And finally, the references as well. Again, you can add in your own references as well as an institution. So hopefully that's given you an idea about some of the pedagogy that we use and what an Epigeum course looks like. And so if you have any questions, I'd be happy to take them. The other thing to note as well is that obviously I've just given you a little whistle-stop tour, and it's a really good idea to trial the programme for yourself, to have a real in-depth look, and you can show colleagues and you can kind of have a real good idea of how it might work for you. So if you would like to do that, there's some details about my colleague Wendy coming up, so you can see how you can get access to a trial. So finally, just some of the benefits that those development group members identified when they wanted to get involved with the programme is responding to the kind of changing environment and student and staff demand for more online options. So with this programme, it's really flexible. You can use it anywhere, anytime, on any device. So it's HTML5, you can use it on your iPad, you can fit it around the demands of a really busy schedule. And when we did the workshop, when we did the 2-day workshop for this, that is something that came up again and again, that it would need to be flexible to work around all of the different commitments that the people who would be taking this programme would have. And again, you can tailor the courses to the needs of your institution. So as a default programme, it's pretty well covered in terms of what you'd want from the programme, but there are always ways to make it even more tailored, and again, we can help you with those. And it's just a much more efficient resource than creating it in-house. That's what we found from the outset. That's why we've continued the development model, because bringing all of those universities together creates something that's a lot more, that just benefits from all of that shared expertise and knowledge, really, and keeping track of progress as well. And again, we've got an implementation and technical team that can talk you through the administrator, the kind of back-end ways in which you can manage the programme and how you can track it and get the best usage possible out of it. So at this point, I'd like to take any questions. As I said, feel free to type them in the question panel as well. I'd be happy to. But for now, I'll leave up Wendy's contact details if you want to jot those down, just for any information about pricing and if you want to have a free trial. But Nigel, just to ask, we've got a question here about, can you use the resource with pre-registration students or students from a non-health background?
Yeah, I think you've highlighted the flexibility of the resource, really, and that people can use it in its entirety or dip into some of the text, some of the exercises, and you can add your own information in there to tailor it to the audience that you want to teach. So with pre-registration students, there will be aspects of teaching and learning which are basic principles of teaching and learning, and students are being prepared to teach and learn with patients and with carers. So that's an important role of a pre-registration student, to teach and learn, to teach patients. So you can use it in that way, or you can actually use it for preparing them to think about their role when they qualify as teachers and assessors of students themselves. And many universities now have mentorship schemes where you've got senior students who will be mentors to junior students, and they will have buddying systems, and you need to prepare those senior students for that role. So I guess the resource can be used for different purposes depending on what the university wants to do.
Great, thank you. And we've got a question here about, is the course approved by the NMC?
That's a good question. Each university will have their own respective mentorship preparation programs approved by the Nursing Midwifery Council. So that's something that a university has to take responsibility for themselves. This particular program hasn't been approved by the NMC, but I think what you did illustrate in your presentation was that what we've tried to do is to show throughout the different sections how the NMC domains have all been covered, so that if the resource is used in its entirety, you will be reassured that all of the domains are covered. And when universities are going for approval or having monitoring visits, they can actually show that they use the resource and how they are compliant with the NMC standards. So while the resource itself isn't approved, when universities have approval events and they're asked to demonstrate how they're compliant, the use of the resource and showing how you use the resource and how the domains are covered would be a real useful benefit to show and help to meet those standards.
Thanks, Nigel. We had a question here just asking if I could bring up the list of partners again. So hopefully, Amelia, this is what you wanted on the screen now. So I'll leave that up, but let me know if it wasn't, and just let me know exactly what it was. But yeah, these are all of the universities who helped create it. So we have another question on have patients and or carers been involved in developing the resource?
Yeah, we were very, I mean, as you probably saw on my opening screen about my background, feel very passionate about this. And so we were really keen to involve patients and carers in a variety of different ways in getting their views on what the content of the program should include, but also to influence some of the video clips and audio clips and the dialogue throughout. So we've tried to use patients and carers from the different partner universities that have been involved in the program, and I certainly consulted myself with some of the associates and carers that we bring into the university and asked for their views, and I think other universities have done the same. So I think they've been used in a variety of different ways to inform the development of the program.
Great, thanks. So we've got a question on what type of student the resource could be used with. I don't know if you covered that in terms of talking about pre-registration.
Yeah, I think that's partly been covered, but I think the other thing to think about is that the resource can be used for mentor preparation programs, but it can be used for mentor updates, and it can be used, so therefore you're actually using it with people that are qualified mentors who need to be able to demonstrate the triennial review and that they've actually had annual updates, and so it can be used either in a university or in a practice setting by people who are facilitating mentor updates, and so that's with people who are qualified mentors or sign-off mentors. So I suppose there's different types of students, mentor preparation students or qualified mentors who are needing updates that the resource can be used with. So you can take particular sections. So, for example, if there has been a problem with in a particular university and practice placement provider that the students aren't being failed, you've shown that there is a section within this resource on failing students, and so that could be used to facilitate some of the principles and discussion and case examples to address that issue, to address that problem, and that can be part of a mentor update session.
Yeah, so thanks for that. We've got, it's more, I guess it's a little bit more of a comment than a question, just about it would be nice to see patients emphasising their expectations of mentors as part of the programme. So I don't know whether that's included in it.
I don't think, as a question, we addressed that in terms of a particular section that you go through. It's just a principle that we've tried to address throughout. So it's probably more integrated throughout the whole package rather than a particular section.
Okay, Great, thank you. So I think that might be it for all of the questions. Of course, if you do think of anything, please do get in touch. I've popped Wendy's details back on the screen for you. So if you do think of anything, just drop her an email and she'll be happy to talk about it further. Again, so she'll send a recording to you early next week as well, so you can follow up then. But just once again, thank you very much for taking the time to come along. Hopefully it was useful for you. Thank you very much to Nigel for your presentation. That was excellent. Thank you very much, and have a lovely rest of the day, everybody. Goodbye.